Hi everyone, and welcome to today's chat, which is all about reflux. So this is a really common problem. I see it a lot in clinic, and I also have my own experience with family members that suffer from reflux. So reflux or acid reflux is basically when the contents of your stomach move upwards into your esophagus, which is our food pipe, the pipe between our mouth and our stomach. And sometimes those contents end up into the back of your throat. So sometimes it can feel like you've thrown up in your mouth. Its technical term is gastroesophageal reflux disorder, either GERD or GORD, depends on how you spell esophagus. Gastro is your stomach, esophageal being the food pipe, and reflux is the movement upwards of the stomach acid. Now, most people experience heartburn, which is that yucky burning pain in your chest. And if this happens frequently and you have some of the symptoms, then it's what's known as gastroesophageal reflux disorder. So the main symptoms of reflux, apart from that sour taste at the back of your mouth, can be chest pain, kind of a burning feeling, nausea, vomiting sometimes, pain when swallowing, difficulty swallowing, sore throat, chronic cough, bad breath, and bloating, usually in the stomach, which is just under your breastbone. So what causes it? Well, it's a good question, because there appears to be no single cause. It can actually be due to lots of different reasons. So at the bottom of your esophagus, there's a sphincter, like a little kind of valve called the lower esophageal sphincter, and it's a round band of muscle that basically links your stomach to the esophagus, and it usually relaxes and opens when you swallow and then tightens and closes once food is in the stomach in order to keep it there. Now, when this valve doesn't function properly by not closing, then it allows the stomach acid, the hydrochloric acid, to actually kind of splash up into the esophagus, which is what causes the burning discomfort and the sour taste. Now, it can also be a hiatus hernia, which can affect the function of that sphincter. Eating too much in one go can actually cause the stomach to distend, and then that stops the sphincter closing properly as well. Lying down too soon after large meals can also create that kind of not enough pressure, which then means that, again, the sphincter doesn't close properly. There's something called small intestinal bacterial overgrowth, and that can create pressure from bloating in the small intestine, which in turn puts pressure on the stomach, which again stops the sphincter from closing properly as well. Something called hypochlorhydria, which is not enough stomach acid. So what usually people think is that if they have reflux, it must be because I have too much stomach acid, so I reach for the antacid to reduce the stomach acid. But sometimes it's actually not that you've got too much stomach acid, it's sometimes that you don't have enough. And it's really important. So the hydrochloric acid, the stomach acid, helps the body to break down and digest specific nutrients, such as protein. It's also really important for the absorption of B12 and calcium and magnesium in the intestines. It's also a barrier to bacteria, and this is really key because it kills off the bacteria and viruses that we swallow that end up in the stomach. And if they're not killed in the stomach, they can end up in the intestines. And they've actually been linked to various cancers, including pancreatic and colon cancer. And I wrote a blog about the importance of the mouth a few weeks back, and I actually talk about the link between bacteria in the mouth that get swallowed, that if there isn't enough hydrochloric acid to kill off those bugs, then they actually end up moving down into the lower part of the gut, into the intestines, and then they can actually cause all sorts of problems, including various cancers. So have a read of that if you haven't read it so far. Now, low levels of stomach acid can impact our ability to absorb nutrients. They can eventually damage the gut and can cause chronic health conditions. We need a high stomach acid so that it can actually have a knock-on effect in our intestines and make sure our intestines are actually alkaline. So the more acidic our stomach is, the more likely we're going to have alkaline intestines, which allows for the absorption of nutrients. So that can actually, if we suppress our stomach acid, can actually cause much bigger problems. So don't always assume that it's because you have high amounts of hydrochloric acid, because sometimes that's actually not true. Pregnancy can also cause reflux. It's really common due to the growing fetus, which puts pressure on the stomach. So there are some risk factors. Obesity, and there's an association with obesity and reflux. Insulin resistance, diabetes is an association between that. So people with obesity and diabetes and insulin resistance are a much greater risk of experiencing reflux. Age, as we get older, the risk of reflux also increases. Certain medications can actually relax the sphincter, so you're more likely to get that splashback. Stress is massive, and that's because when we're stressed, a certain part of our nervous system called the sympathetic nervous system takes control, and it's all about survival. And our parasympathetic nervous system, which is all about the relaxing and resting and digestion, that actually kind of is suppressed while we deal with the survival. So when we're stressed, we're much less likely to be able to digest our food properly, and that can actually impact our stomach acid, and we don't produce the stomach acid that we normally would. So stress is massive. And again, low hydrochloric acid, as I said, so the food tends to sit in the stomach for longer because it's not being broken down efficiently, because the stomach acid isn't as acidic as it needs to be. And we need acid to actually break down our protein so that our protein can be absorbed. When we have a low hydrochloric acid, it encourages the growth of H. pylori bacteria. So that already lives in our gut, in our stomach, and the acid, and it's used to living in acid, but the acid kind of regulates the amount of H. pylori. So when we have low amounts of stomach acid, H. pylori can actually overly flourish, and that in itself can create reflux. That can also create stomach ulcers and all sorts of other problems. And SIBO is more likely as well, small intestinal bacterial overgrowth, because again, if we don't have an acidic stomach, that then affects how our small intestine functions, and that then can mean that the bacteria could take up residence in the small intestine when they shouldn't, because the pH in the intestine is changed. Diet makes a big difference. So fatty foods, chocolate, coffee, alcohol, spicy foods, acidic foods like citrus, and also fizzy drinks. They can all either affect the pH of the stomach acid, or they affect the pressure on the sphincter, which means it doesn't close properly. So why does it need to be taken seriously? It really does need to be assessed and treated if you think you have reflux. It can lead to a chronic cough. There is something called reflux cough syndrome. It can lead to asthma, which is known as reflux asthma syndrome, which is slightly different from your normal asthma. And also reflux dental erosion syndrome, because as the acid moves up to the back of the throat and you've got the acid in your mouth, it can actually destroy your teeth. It's associated with pharyngitis, sinusitis, that inflammation of the sinuses. If you've got any kind of sinus pain or recurrent sinuses, that could be due to reflux. And also recurrent otitis media, which is in ear infections. It's also linked to fibrosis of the lungs. So if the constant movement of acid up the esophagus isn't stopped, then it can actually lead to all these other conditions. Eventually, the esophagus can get eroded and ulcerated, and then you can get what's known as Barrett's esophagus, which can then also lead to cancer of the esophagus. So reflux is more than just an irritant. It really does need to be dealt with seriously and assessed and treated. So current treatments are that you might be prescribed antacids. If you end up taking antacids every day because you're getting chronic reflux, then you really do need to go and see a GP or a doctor and get a proper assessment. There are H2 blockers, so these lower the acid in your stomach. Some of the ingredients in these is a particular ingredient called N-nitrosdimethylamine, or NDMA, and that's been known to cause cancer, and it's actually been banned by the FDA in America. So just make sure that you know what ingredients are in the H2 blockers. There are also your proton pump inhibitors, which is your omeprazole as an example. So these also lower the amount of acid in the stomach, and they all have long-term consequences. By reducing the acid in the stomach, you are more at risk of getting possibly H. pylori infections or other types of infections. And as I said, it's not going to kill the bacteria that you really don't want moving into your small intestine, and it possibly actually will stop you digesting and absorbing your proteins and various vitamins and minerals as well. So you really want that to be a last resort. Surgery is possible. particularly if that sphincter between the stomach and the esophagus is not functioning properly. And if that's the reason why the acid is splashing up or moving up the esophagus, then you can have this surgery. The surgery is known as fundoplication. There is a time limit to how long the procedure lasts, around 10 to 15 years, and it can be that the sphincter loosens again over time, and then medication might be the only option because they can't do the surgery more than once. And as I said, sometimes that's really important because you really don't want to be getting Barrett's esophagus or esophageal cancer if you're not actually managing your reflux. So there are traditional remedies that may or may not help. Milk is used a lot. It can temporarily help due to the milk being alkaline, thereby neutralizing the acid. In some people, it can actually make reflux worse once the fat's digested, because in some people, it's the fat in our diet that's actually causing the reflux. Baking soda added to water is the same as milk. It's alkaline. Some people will gain temporary relief, and it's generally considered safe if taken in small doses now and again, but it should not be taken long term. And it should not be taken in high amounts because of the sodium content, which can then cause high blood pressure and other side effects as well. So it's something that my husband used to use a lot, but really not good in the long term. Ginger, so some people can benefit from chewing ginger, candied ginger, or drinking ginger tea. Can actually exacerbate reflux in some people as well. Same with peppermint, can actually make things worse in some people. But ginger is a digestive enhancer, and it's excellent if you're feeling nauseous or you have vomiting, but just be really careful with it because some people it works for, some people it actually makes worse. Chewing gum is another remedy. Very small study back in 2005 showed that chewing sugar-free gum half an hour after a meal could reduce reflux, but it was a really tiny study, only 31 people in that study. So it really isn't large enough to say this is a really good intervention. So my top tips, and there's quite a few. So if you have had chronic reflux, and if you have been living on antacids, then please make an appointment to see a doctor to get it assessed. If you have pain or difficulty swallowing, then this has to be, it must be assessed by a GP immediately. And that's being really serious. It must be assessed. Maintaining a healthy weight is really important because of the association with being overweight or obese and reflux. Reduce or quit smoking. There's a big link between smoking and reflux as well. Nothing good comes from smoking. Consider reducing alcohol, or at least don't drink alcohol on an empty stomach. Alcohol can reduce inflammation in the mouth, throat, and the esophagus. It can impair motility, which is the movement of food through the intestines or through the whole gut, and also clearance of food in the stomach. You don't want your food to be sitting in your stomach for a long time. You want it to move through. So alcohol can actually impair that process. So it's going to sit in the stomach for longer, which means that you then become more at risk of reflux. Reduce the spicy or fatty foods or the citrus foods. Have a look at what foods are actually possibly exacerbating or causing symptoms. So track your diet with your symptoms, see if certain foods are causing it, and then get rid of them for a period of time and see if your reflux goes away. Consider reducing coffee. I know, trust me, I would not say that if it really didn't make a difference. Coffee is acidic. It can exacerbate reflux. Coffee was a game changer for my husband. When he stopped drinking coffee, his reflux went away, and he's had reflux for years. And it got worse when he came to New Zealand, and massive difference when he stopped. Didn't want to stop, but it really did get rid of the reflux. Could be worth looking at your protein intake, maybe even considering a collagen supplement, especially if the issue is with the sphincter itself, not closing. Amino acids and collagen might help to strengthen the connective tissue. If your hydrochloric acid is too high, and you've played around with the fact that it's not because it's too low, if it's too high, then you can try apple cider vinegar. A teaspoon of apple cider vinegar in a glass of water to begin with before meals, and then over time you can increase to 1 tablespoon. Try that before using antacids or other medications and see if that works. Increasing fruit and veg. I know I bang on about fruit and veg a lot, but it's really important. Do it slowly if it's something that you don't have a lot of in your diet. You really want to start off small and work up. And you also want to track to see how you feel, because if you bloat and feel uncomfortable when you increase your fruit and veg, then it's worth finding out if SIBO is the reason for the reflux. If you increase it slowly and you don't have any bloating or any discomfort, then keep increasing your fruit and veg. It means that you're going to be getting enough anti-inflammatory and antioxidant and vitamins and minerals, which are really, really important for any inflammation that the reflux might have caused. Low intake of fruit and veg has been associated with an increased risk of reflux, Barrett's, and esophageal cancer. And ensuring that you're having a good amount of fiber from your complex carbs, your fruit and your veggies also has been shown to reduce the risk of reflux and also Barrett's and also esophageal cancer. Have a large breakfast and lunch and maybe a much smaller dinner, which is what actually our bodies are designed to eat, because then again, you'll take the pressure off your stomach and the digestive system. Make sure there's at least 3 to 4 hours before dinner and bed. You know, lying down can exacerbate reflux. So you might need to elevate your head during sleep, particularly if your reflux is worse at night. I certainly remember being pregnant and having dreadful reflux when I lay down and I had to elevate myself and then I could sleep properly. If the reflux is due to low stomach acid, then you might not be consuming enough zinc or B vitamins, which are required for its production, as well as protein. Stress, smoking, alcohol use can all deplete stomach acid. H. pylori infection, the bacteria in your stomach, if that's actually got to high amounts of numbers and it's unresolved, that can also eventually lead to low stomach acid. So make sure you rule that out too. It's worth going to speak to your GP and getting checked for H. pylori before you kind of decide what you're going to do about it. You can also, if you've got low stomach acid, consider having bitters before you eat. You can use things like Swedish bitters, bush bitters, gin and tonic without the alcohol. Betaine hydrochloric acid is a supplement that you can have. It must be taken alongside protein and you build up slowly. So that again is if you have a low stomach acid and you know you have low stomach acid. There are certain herbs that can help to soothe the esophagus. Herbs like marshmallow, licorice. Be very careful if you have high blood pressure. You don't want to have licorice if you have high blood pressure. Slippery elm can be really good at helping to feed the good gut bacteria, but also helping to soothe the gut if it's inflamed. Hoheria, which is a beautiful New Zealand herb, which is very similar to slippery elm and is not endangered. So Hoheria is beautiful, and you can have that in as a warm tea or cold. And chamomile tea, some really lovely research on chamomile, and chamomile can help with the stress that might be causing digestive problems, as well as actually helping with digestion, absorption and bloating and reflux as well. There's a really cool product called Iberogast, which has got 9 herbs in, and that can also be really helpful for reflux as a temporary symptom manager too. It's always really good to go and have an appointment with a naturopath or a herbalist or a nutritionist to get some support around your diet, and also to make sure that those herbs are safe, particularly if you're on any medication. Don't take herbs if you're on medications, because they can interact with your medications. And if you are taking proton pump inhibitors like omeprazole, for example, don't take herbs unless you check to make sure they don't interact with your medications. That's really important. So please reach out to me, ask any questions, come make an appointment with me. I do free calls just to find out what's going on and if I can help, if you'd like some advice about your reflux. So have a fantastic day, and I hope that helps, and I will see you soon.